everyone. I'm Amelia Khoei. I'm a fourth-year urology resident at the University of Michigan. I'm happy to introduce Dr. Ebert for our discussion on sexuality in the DSD population. If you don't mind introducing yourselves.
Yeah, I'm Dr. Kristin Ebert. I'm a pediatric urologist and assistant professor at the University of Wisconsin, and I'm also the director for transitional urology there.
Great. Thank you for the intro. I have a list of questions here. I'm going to start out with the basics. What does differences in sex development mean in everyday language?
So differences in sex development, or DSD, is a group of congenital conditions that affect the sex chromosomes, the gonads, the internal reproductive tract, and the external genitalia, such that these may not represent the typical male and female binary.
And how do patients with DSD conditions have differences in sexuality, intimacy, and relationships?
That question is a little bit hard to answer. And I think the truth is that these conditions are rare and they represent a wide spectrum. And so interpreting the studies that are available on them can be challenging because the studies are small, they're heterogeneous, so it represents a mix of patients. And then to complicate matters, the long-term management of these conditions is evolving. So as we do studies on adult patients, it may not reflect the current management that's being done in pediatrics today. But the bottom line is there have been some very large-scale studies, primarily out of Europe, looking at sexuality in the DSD population. And the outcomes are not great, honestly. So probably about half of patients are not satisfied with their sex life. And some of them, maybe up to a third, maybe not having sexual intercourse at all. And so I think it can be very challenging. It's not to say that patients can't have a satisfying sex life, but I think that's something that our patients should be aware of and that we can be doing a better job as doctors to help support them in this.
Thank you. That makes a lot of sense. I'm also curious of any misconceptions about sexuality in the DSD population. I guess it can go hand in hand on how that could be affecting intimacy for these patients as well. But what are some misconceptions regarding that aspect?
Yeah, I was reflecting before we met on how to address this. And I think one of the misconceptions is that sometimes these patients get lumped in with the trans community, for example. And I think there are some parallels, but really they're their own unique community and have their own unique medical needs. And so, perhaps both types of populations may be having genital surgery or need hormonal supplementation, but that sort of thing. But there's a different, I think, psychological component and some struggles that patients can have with maybe not fitting into the gender binary in one way or another. So I think that can cause some conflict, with their own feelings about themselves and their own sexuality and that sort of thing. So
thank you for that insight. How can patients advocate for themselves when they're working with healthcare teams?
Yeah, I think one of the things that we're, of course, biased about as urologists is when a patient comes into my office, I want to know, how's urination, that sort of thing. And so some of these patients who have had surgery, that's a lot of what we're focusing on is, their hormones, their urinary abilities, or menstruation for female patients. But maybe not doing as good of a job talking to our patients about sexuality, their feelings around their own genitals. And so I would encourage patients to make sure that you bring it up and talk about it. And I try with my own patients to really create that safe space. I'm the right person you should talk about with these kinds of questions. But I think patients often feel embarrassed. They don't want to talk about it, but we should talk about it.
Thank you for opening up the floor for your patients and making it a little bit easier for them. But it's a good reminder for everyone else to also consider that aspect of their health. What advice do you give to young people with DSD who are exploring their identity and sexuality?
I think when I'm talking to a patient who's maybe about to become an adolescent, when they're a child, maybe they didn't know as much, they're different, but as they get older, they're starting to become more aware. And I think what I usually say to them is, it's okay to feel different. It's okay that you are different, and let's talk about that. So I think that's the way that I try to approach it.
And in a similar way, how can partners support someone with DSC in a healthy relationship?
I think a couple things. I think first of all, being okay with taking things slow, especially like in a sexual aspect, but even just their own willingness to share what they've been through with you could take a while, because some of this is can be traumatic for patients, honestly. So um, maybe not moving things along at the same rate sexually that you might with another partner. And then I think the other thing to know is, you may need to be okay with kind of other options for intercourse besides the classic, penetrative penis and vagina intercourse, and that there's lots of ways to experience pleasure, even if your genitals are different.
That's great. And if you had 3 takeaways to share with patients today, what would you say?
I think the first one I kind of touched on earlier, which is it's okay to be different, embrace that about yourself. Like not everybody's the same. And so trying to make yourself fit into a mold is probably not going to make you happy. And that's what, I think it's okay to embrace that about yourself. So I think number 2 is, you willing to talk to your doctor about this? Like we want to hear about these concerns. And if you don't talk about them, we don't know how to help. Which brings me to the third point, which is that there are good treatment options available. So can we make everything, perfect? No. But if you're having issues with erections or arousal or things are painful, that's something that you should be able to talk to your doctor about so that he can help you.
That's a really prominent ending or point there. And, being okay with being different is always a good reminder. Thank you, Dr. Ebert, for sharing your experience with patients with DSD.
Thank you.